Oral testosterone has been around for many years. And when you talk with patients, most would rather just take a pill with their daily prescription and our supplements. Considering some of the drawbacks you had just mentioned, it doesn't involve a needle causing pain. There's no risk of transference like you have with the gels. I was going to see if you could review with our listeners, historically, why has oral testosterone not been a good option in the past?
It's a great question. And what we focused on earlier was how do all those vitamins, minerals, nutrients, hormones get around in our bodies? And the way it is done is through the main transport system, which is the blood circulatory system. When you take an oral pill in the heyday, and the main one was called methyl testosterone, it was absorbed through the lining of your gut directly into the bloodstream. And it just so happens that from the gut, the blood will then go to your liver. And then we found out that actually when that testosterone, the methyl testosterone, was metabolized or processed in the liver, it actually was toxic to the liver. And we call that hepatotoxicity. Now, what's amazing is that in the modern era, for the modern man, the drug designers have come up with a really cool concept, which is, hey, I remember there's a secondary system of transport within the body, and that's called the lymphatic system. And it does four things. It helps get rid of waste products in our body. It helps with our immune system. It helps maintain a healthy levels of body fluids. But it also is important with absorbing fats from our foods through the lining of our gut. And the drug designers are like, hey, maybe we can use this secondary system to offset the problem we had with that first generation of oral testosterone. And it worked. So when we talk about fats that we absorb, we think about cholesterol, right? What they did is they found that in plants, there's phytosterols, which are highly related to cholesterol. And now, hey, if we take that molecule, blend it and bind it to testosterone, specifically testosterone undecanoate, we can actually get it into the body through the lymphatic transport system. And later on, it will then join the circulatory blood system, but with the advantage of skipping the liver. So now we've bypassed that problem of hepatotoxicity. This is a game changer, right? We've now presented a new option of oral pills for our guys, which did not exist before. And that's just great to have all the cards on the table for guys to choose what works for them.
It's definitely exciting to now have an oral testosterone option with Kysotrex that's safe without the liver toxicity, yet still effective.